Mr. Speaker, House Resolution 444 provides a closed rule for consideration of H.R. 3495, the Women's Public Health and Safety Act. Over the past few months, extremely disturbing information has come to light about the activities of abortion providers and their sale of unborn children's hearts and other organs for compensation. In light of those discoveries, we provide for consideration today of crucial legislation to ensure states are free to ensure their limited taxpayers' dollars do not provide sustaining funding to abortion providers whose activities are found repugnant. H.R. 3495, the Women's Public Health and Safety Act, allows states to make a decision identical to the one this House made earlier this month when we passed H.R. 3134, the Defund Planned Parenthood Act, which stopped the flow of taxpayer dollars to Planned Parenthood as investigations continue into its sale of unborn children's parts. As my colleagues noted during debate on H.R. 3134, arguments from the minority that this bill will prevent women from accessing health care ring hollow. We know that federally qualified health centers and rural health centers outnumber Planned Parenthood clinics at a rate of 20 to 1. Of these, over 13,000 federally qualified health centers and rural health centers, women have access to any health care service provided by Planned Parenthood or other abortion providers, with one obvious exception. Because they are federally funded, these true health centers do not perform abortions. Clearly, despite opponents' best efforts to argue otherwise, this bill does not deny health care services to women. It does allow states to decide whether their Medicaid funds should support a provider whose atrocities have shocked our national conscience and devalued human life. It's not surprising, though, that we're hearing these hollow arguments about access to health care services as the political machinery of abortion providers has kicked into high gear with scare tactics to protect their business. Abortion is, after all, a business, and Planned Parenthood is the single largest abortion business in the country. Recently, they performed over 325,000 abortions in 1 year. That's nearly 900 every day at a rate of over 35 an hour. They're able to continue that activity in part because Planned Parenthood has received over $1 billion in 3 years from Medicaid alone. I've spoken previously on the floor about the absurdity of providing taxpayer funds to organizations that have had their willingness to accept compensation for the remains of unborn children exposed for all to see. Several states, including Louisiana, Arkansas, Alabama, and Indiana, have recognized that alarming truth and acted on their own to stop providing abortion providers with taxpayer dollars through Medicaid. Unfortunately, the Obama administration has forced those states to continue providing taxpayer dollars to abortion providers. Thankfully, when the framers of our Constitution established our nation, they saw fit to give states a right to determine their own affairs and the disposition of their citizens' taxes. Today, we restore federalism to the Medicaid program and enable states to make their own choices on which Medicaid providers to accept, allowing them to stop the flow of taxpayer dollars to organizations that accept compensation for the sale of well-developed unborn children's hearts and bodies. Mr. Speaker, I commend this rule and the underlying bill to